I knew that. Okay. Chairman Quayle, members of the subcommittee, thank you for the opportunity to testify before you today. I am Willa Fields, a professor in the School of Nursing at San Diego State University in San Diego, California. Additionally, I was honored to be selected as the chair of the Board of Directors of HIMSS, the Healthcare Information and Management Systems Society, as of July 1st this year. I am honored to have the opportunity to provide you the perspective of HIMSS, as well as my own, on the status of health information technology adoption, some of the challenges we still face as a nation, and recommendations on selected issues requiring congressional attention in the coming years. HIMSS is a cause-based, not-for-profit association exclusively focused on providing global leadership for the optimal use of health information technology for the betterment of health care. Founded 52 years ago, HIMSS is headquartered in Chicago with additional offices in the United States, Europe, and Asia. We represent 50,000 individual members, of which more than two-thirds work in provider, government, and not-for-profit organizations. We also have 570 corporate members and more than 225 not-for-profit organizations that share our mission. As you recognize, health IT is an essential, foundational element of any meaningful transformation of the nation's healthcare delivery system. Robust nationwide adoption of health IT, including electronic health records, health information exchange capabilities, and mobile health devices. All of these are essential to achieving safe, effective care delivery, payment reforms, and engaging patients in their care. Health IT also enables timely, accurate, and appropriate collection and dissemination of patient information in a private and secure manner. While there is still much work to be done, adoption of interoperable health IT systems continues to expand thanks to the incentives provided by the HITECH Act. We are only 2 years into the program, and there has been a great shift toward electronic health records throughout the nation. HIMSS Analytics has performed a cross-reference of hospitals achieving Stage 1 meaningful use against their scores on the Electronic Medical Records Adoption Model, or EMRAM, which is a HIMSS analytic tool to track U.S. civilian hospitals on their progress toward a mature, paperless electronic environment. The results demonstrate that hospitals are rapidly evolving to higher stages on the EMRAM scale. Such results are clear indicators that government incentives are achieving their mission of accelerating the widespread implementation and meaningful use of certified electronic health records in the United States. More importantly, the top-ranked EMRAM Stage 6 and 7 hospitals reflect the rapidly escalating move of the United States hospitals toward interoperability, which will lead to information exchange. The EMRAM system and its findings are explained further in my written statement. The evidence, including data from the Centers for Medicare and Medicaid Services, the Centers for Disease Control and Prevention, and HIMSS Analytics, suggests that, as a result of the HITECH Act and the substantial investment the public and private sectors have made, a groundswell has been achieved in the adoption of health IT and specifically electronic health records. We believe the time is very near when informed patients will use adoption and meaningful use of health IT as a key factor in selecting a caregiver in a care setting because of the opportunities these systems provide for access to information. Without the HITECH authorized meaningful use of electronic health record incentive program, the nation would not be realizing adoption and implementation of these systems, which includes the rapidly expanding ability to exchange information privately and securely across systems and regions. HIMSS strongly encourages the continued bipartisan support of Congress for the earliest nationwide adoption and implementation of electronic health records and the Meaningful Use Program. In conclusion, in order to improve the quality of health care for all Americans while also controlling costs, HIMSS recommends 7 strategies for Congress. 1, continue your strong bipartisan support for the adoption and meaningful use of electronic health records. 2, continue to support and sustain the Meaningful Use Electronic Health Records Incentive Program. 3rd, direct the administration to initiate collaboration with the private sector on an appropriate study of patient data matching and the adoption of a nationwide patient data matching strategy. 4th, support harmonization of federal and state privacy laws and regulations to encourage the exchange of health information across systems, payers, and vendors, continue to support programs and services to educate providers and provider organizations on how health IT can and should be used to engage patients in their health care, continue to support and sponsor pilot programs addressing the collection, analysis, and management of clinical data and quality for reporting purposes. And 7, preclude any additional delay in the nationwide implementation of ICD-10, the International Classification of Diseases that is set to be implemented October 1st, 2014. Let me reiterate, electronic health record adoption and implementation has passed the tipping point in America. The evidence, including HIMSS' own analysis, indicates continued progress on the implementation of health information technologies. My written statement citing evidence of these upward trends in health IT adoption and discussing the rationale for these recommendations in more depth has been provided for the record. Clearly, the nation would not have made the significant progress toward electronic health record adoption and health information exchange that it has without the Meaningful Use program authorized by the HITECH Act. Perhaps in many years, healthcare might have caught up with other industries in the adoption and information technology. But in the meantime, quality of care and access to care would have continued to suffer, and the nation would have continued to pay much more for health care than necessary. There is more work to be done, especially in interoperability, health information exchange, privacy, and security. HIMSS recommends that in order to improve the quality of your constituents' health care while also reducing its costs, Congress should continue its strong bipartisan support for health information technology. I and my 50,000 professional colleagues stand ready to work with Congress and the administration. Thank you for the opportunity to speak with you today, and I would be happy to answer your questions.